When you start bottom molding, there are a couple of things that I want to tell you. A right-handed student should always try to keep his flame on the left side, so that after he does some work, when he comes to the tray, if it's on the right side, you end up burning your sleeve or your glove, which gives you a very bad burn. I have water bath here, whip mix water bath set to 65 degrees. 60, around 60, 65 is fine, 65 degrees. And I have curved green sticks, and I'm going to do the bottom molding. The important thing when you do bottom molding is to remember that it is sectional, and so you want to always do section by section, but you also want to do it bilaterally, and you also want to keep your tray dry, otherwise the green stick will not stick onto the tray. The green stick impression compound is used to record the impression of the vestibule. So that's why it's an impression compound. This material needs to be manipulated directly over a dry flame, not manipulated in the water. This water is just for tempering, to lower the temperature to an acceptable temperature for the patient in the mouth, not for softening the compound. When you want to soften the material, you want to run the material into the flame, and I always suggest that you run a very small bit so that you can control it well. So you run the bit, you can see the shiny glossy appearance coming off, and you want to rotate it as well as move it in and out of the flame because you don't want to burn it. Once its flame starts to slump, you want to bring it to the tray, posterior part, the retrozygomatic part, and you rotate your green stick off, and off it comes. This will not happen if you have softened a greater amount. You want to dip it in the water and just smoothen it. Maybe you want to flame this a bit. If you feel it's too much slumping inside, wet your finger, and you can just pull it out a little bit with a wet finger. But don't try to manipulate with your finger. Flame it back, nice and shiny. Dip, and it should be ready. Here, rotate the tray into the patient's mouth. Ask him to close the mouth halfway before you place. Sucker from nose, and then place it in. Okay? Harak yamin yasar. Behtana. Behtana. Aiba. Yamin yasar. This movement you're doing for the retrozygomatic region because, or the distal buccal of the tuberosity, because this is where the coronoid process of the mandible is going to come in when he is chewing, and if the thickness there is too much, it's going to hurt him. It's okay. So you see this part, you need to have a little more clearer record, but you can still see a small depression. This is a coronoid process. I'm going to add some material here, and I'm going to do it again. With an instrument, I'm just going to remove any excess on the inside. Okay. Then I'm going to add some more material on the outside here. I'm going to dry the compound again. I'm going to flame it a little bit so that it is ready to take on a new layer. And then, like before, flame up a bit. And it starts to slump, you know the material is ready. Okay, I want to just add some material into this region. Okay, dip, roll so that's ready for the next use. Flame, dip, should be ready. Back in here, rotate the tray in. Hamzain, Sakarnus. Okay. Harak yamin yasar. Okay, very nice. If you look inside, you can see the coronoid touching the tray compound in that area. Okay. So you see this now? You can see this area is thinned out. This is thicker and this is thinner. And that shows you that this is the area where the coronoid is, and it's not going to interfere with this biting. I'm going to go on to this side. can remove some excess material from the inside. Heat the tip of my instrument. I always prefer to remove it as I'm working, because if I leave it for the end, I feel that there will be a displacement of the tray as the material thickness increases on the inside. Go over to the other side. My stick is ready. Just flame it, rotating in and out. Starts to slump, it's ready. Place the material and then rotate it off. Okay, hold it on. Just put it onto the tray, soften it a little bit on the flame. 1, 2, and rotate into the mouth sucker from nose, halfway closed. Place it, and then harak yamin yasar. Okay. All right. You see a lot of material has gone on to the inside. I want to take this off, add some material here again. My tray is dry. I'm going to just soften it a bit so it can take on a new layer. Add some material like that. Like I told you before, we need the thickness of the coronoid. Want to flame it so it's soft. Yep. Sucker from this. Place it. Harak yamin yasar. Okay. All right. So I have that. Clearly you can see the difference in the bulge. This is thicker, this is thinner. It's where the coronoid is touching, so I want just that much. I'll remove the excess material from inside. Okay, I'm going to come over into the more anterior segment, which is my buccal vestibule region. This is the distal buccal. Behind this is the buccal vestibule, including the buccal frenum. So I'm going to come into that region. I want to mold this and extend there. Just flame that tip a bit. Add this material here. We will go across my frenum area and just flame the old thickness there because I want to mold it. That's it. Dip, dip. Good. So I'm going to just go up, out, in. This is the basic motion for all border molding. Up, so you want to lose out trap tissue. Out, so you want to get the depth of the vestibule, and in to get the width of the vestibule. And then you want to move the buccal frenum back and forth so that it is recorded. Up, out, in. And I suggest that you wait for a second because impression compound is a bit thick. It takes a few seconds to flow. All right. So you can see that you have a kind of a connectivity issue here. Want to smoothen this off and then come on to this side. Is there enough light to see? Can you see it? Okay. So for this, I'm just going to flame it. I'm going to remove the excess first before I do any of that. Tip. Heat the tip just a little bit. Remove the excess from inside. Alright. And then you want to flame it a little bit so that it will connect on. Here again, I'm going to make sure my tray is dry. Add on my material. Soften it a bit so it can connect. Just past my buccal frenum. Just past my buccal frenum. Okay. 1, 2, should be okay. Back in here. Goes back rotated into the mouth. Traya, relax. Up, out, and in. Again, up, out, and in. If the thumbs are in, okay. For the buccal frenum, you want to move it back and forth. We need to hold it a few seconds for allow the material to flow. Otherwise, the kind of motion students usually do a cycling motion. This really doesn't help. You got to go up, out, in, and hold it for a 1 to 2 seconds so the material can flow. Right? So see, my frenum, I need to come a little bit more with my material, so I'm going to do that again. I'm going to remove this excess, as always. Remove the excess, yeah. Dry my tray. Soften it a bit so it will connect. And you want to add on material. I'm going into my label frenum there. I'm going to soften a bit more. Add on to the other side as well. Okay, needs to be a bit more soft. Flame. Back into the patient's mouth. Masmasmaya? Did you wash? Okay. Want to place it correctly there. Sohna? It's okay? Go up, out, in. This region, up, out, in. Irhiruhu. In this region. And holding with your middle fingers. This is the frenum and the labial vestibule. Because this is how the frenum works. You want to simulate function in all your movements. Okay? Abui, behtana? Behtana? Just gidam. Okay. Want him to just do this so that the frenum is there. Okay, relax. I want to check. All right, seems okay. Have some excess in the inside, so I'm going to remove that. I also have some slightly deficient here. I'm going to add up material in this region as well. Heat the tip of the instrument. I want to clean it. Okay. I'll just flame the area I want to add material into. This vestibule, yeah. Mas moya bui? Okay, so that's good enough. All right. This is my new addition there. I'm going to come in, place it back. You don't want to stretch the muscles too much. Okay. Okay, so you see it's covered up. Now you want to go for the posterior palatal seal area. For the posterior palatal seal area, I prefer a bigger piece. I want to heat up more because I want to add more. Okay, no problem. I think it will stick till the posterior palatal seal. Okay, you want to place it. Alright, I'm going to flame it. Mas moya bui? Mas moya? Okay. Dip. Dip. And you want to gently place it. Iftainak. Aina. Okay. If the excess material that comes off, you can actually just adapt it back onto the tray. Just adapt it back onto the tray so it doesn't irritate his throat. Okay. You can have him relax. You don't really need to do anything because your tray is well extended into the vibrating line. This itself gives you enough retention. شنو اسمك أبوي؟ Ahmed bin?
مصباح.
Okay. After him speaking, it's not coming out anywhere. كم عمرك؟
65.
65. So after 65 also it's going to stay. The important thing is it should be in function. تريا يرخي روحك. So the important thing is it should be in function. And the other important thing is that it should be smoothly onto the posterior vibrating line area. I need to remove these excesses and develop a posterior palatal seal. I'll show you in the next video.